If you've gone to the doctor with knee pain and gotten an x-ray and been told that you have knee arthritis, you may feel like your only option is to have surgery. So today we're going to talk about, does having knee arthritis actually indicate that you have to have surgery? Is there a way to heal naturally without surgery? And does it depend on how much knee arthritis you have? So buckle up, we are going to cover all of those topics today. I'm Dr. Amy, a PhD trained orthopedic manual physical therapist, and I am here to educate people regarding their knee symptoms so that they can find the answers they're looking for. First off, let's understand what knee arthritis is. So arthritis anywhere in your body is an abnormal bony formation. You see, every joint in your body is covered by cartilage, and cartilage is like this spongy tissue that helps to keep the joints from slamming together. So that means if the joint is not moving correctly, the cartilage is not getting its nutrition. And when it degrades, there's an abnormal bony formation that occurs. That abnormal bony formation is arthritis. So really what it means when you have arthritis is that that joint hasn't been moving normally for a long period of time. Now there's different grades of arthritis, 1, 2, 3, and 4, 1 being the least severe, 4 being the most severe. So if you have a 3 or a 4, that means that joint has not been moving correctly for a very long time, or there's been abnormal pressure, because what's happened is the cartilage has degraded or it has gotten thin, and it's not protecting the joint the way it's supposed to. And this is a super key point to understand when you're talking about if you need to have surgery or not. Because the truth of the matter is you need to get to the root of what is causing that joint to not move correctly and to lead to the arthritis in the first place. And this is particularly true in the knee because the knee is a very simple joint. It's a hinge joint, which means it only moves in 2 directions. You straighten your leg, you bend your leg. You straighten your leg, you bend your leg. Now, there's a little bit of rotation that happens in there, but really that's not the thing that leads to the knee arthritis. It's because your knee is not bending and straightening correctly. Now, you may be saying, I can bend my knee, I can straighten my knee. So how did I get this knee arthritis, Dr. Amy? Well, the truth of the matter is something's happening in that joint. And most commonly in the knee, it's that the muscles are tight that cross the knee joint. So I'm talking about the quads in the front, the hamstrings in the back, and that's causing an abnormal compression. That abnormal compression leads to cartilage degradation or destruction of the cartilage, which then leads to arthritis. Now, you go to the doctor, particularly the surgeon, and they do an x-ray and they see that there's knee arthritis and they say, aha, I know how to fix this. We just put in a whole new joint. And while yes, I do understand that putting in a whole new joint will fix the arthritis problem because you'll have a whole new joint in there, it may not fix your pain problem. So many people feel like the pain they have in their knee is coming from the arthritis. And when you can see arthritis on an x-ray, it makes sense. However, it could be that the pain that's coming from your knee is actually from the ligaments, the tendons, or the muscles, and the arthritis is just the effect of that pressure being put on the knee. Which is important because when you have a knee surgery, they go in and they replace the joint and they cause damage to the ligaments and tendons and muscles. Now, I'm not saying they intend to cause damage, it's just a byproduct of having surgery. I mean, obviously they got to go in and cut through all that stuff in order to get to the knee joint. Too many people that I see come in after knee surgery and they are having pain in their knee that continues after surgery and they don't understand why, because it's not coming from the joint. And I clearly understand that. It's not coming from the joint. You have a new joint. The arthritis is gone. That doesn't mean that that's going to solve your pain problem, because if it was coming from a ligament, tendon, or muscle in the first place, and then you went and had surgery, which further irritated the ligament, tendon, or muscle, you could still have the pain after surgery. Now, you may be saying to me, but Dr. Amy, my doctor told me it was bone-on-bone arthritis, and there was nothing that could be done other than surgery. Friends, I can tell you, I have treated hundreds of patients who had bone-on-bone knee arthritis who did not choose to do surgery, who were able to do all of their activities pain-free. And you may think that that sounds crazy. So let me tell you about one particular patient who we love so much around this clinic. We're going to call her Sally. So Sally came to me after she had fallen on her knees and she had a lot of knee pain. Then she went to the doctor, she got an x-ray, and the doctor said, oh, you have knee arthritis, you have to have bilateral knee surgery. Well, Sally didn't want knee surgery, and so she was asking me, is there something that you can do to help? Now, here's the key thing that I pointed out to Sally. Sally fell when she was hiking. So she was hiking pain-free with knee arthritis. You need to understand, knee arthritis does not come from one particular accident, at least not immediately. Knee arthritis accumulates over time. So Sally had the knee arthritis that had accumulated over time, and then she fell on her knees, and then she started having the pain because now she has inflammation, which is just making everything worse. The muscles, ligaments, tendons, and the joint are all super inflamed and very, very angry, which triggers the knee arthritis pain. Now, Sally really wanted to avoid surgery and really wanted to work hard in order to get her knees moving correctly and eliminate this pain. Now, I will tell you, Sally did have to work super hard because she did have the knee arthritis. So there was years of accumulation of an issue here. I'm not going to say that it was an easy answer and in 1 week she was pain-free and could do all the things she wanted to do. But I will tell you, with her diligent effort and our work in the clinic, she was able to get back to all of her activities pain-free, including walking on the beach, which is Sally's absolutely favorite activity. And I love that about her because that's one of my favorite activities as well. So Sally is now able to do anything she wants to do. She has painted her house, she has done yard work, she has traveled around the world, she has been able to swim and bike and walk and hike and walk on the beach, all pain-free. Now, I'm not going to tell you that I'm a magician and there's a magic answer for this. This was a lot of hard work, not only on Sally's part, but on my part. And she does have to be diligent to keep up with all of her exercises and her whole entire routine in order to keep herself pain-free from the knee arthritis. Because I cannot change knee arthritis that has already happened. That is literally impossible. Knee arthritis is an abnormal bony formation in the joint, and I can't really change bones. However, what we were able to do is change the ligament, the tendon, and the muscles, all the soft tissues around that knee joint, so that she was able to do everything she wanted to do pain-free. Now, you may be thinking to yourself, this sounds super, super crazy. So I want you to go ahead and download our free guide that will give you some tips that you can implement today, including the ones that help Sally get back to the success and the life that she wanted to live. If you'd like to understand more about arthritis and how it affects your whole body and how the foot and the hip can contribute to knee pain and knee arthritis specifically, I'm going to encourage you to check out my book, Movement is Life. In there, we talk about all the things and how it's all connected.